and Brad, the two most famous physical therapists on the internet.
Hi, I'm Bob Schrupp, physical therapist,
Brad Heineck, physical therapist.
and together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
And he's right along with us.
You better believe it.
Okay, today, Brad, we're going to talk about posterior shoulder dislocation. And is this your shoulder pain? I guess in the interest of being complete, like we're going to cover all subjects, that's why we're covering this one, right?
Right. Well, we had I had a viewer specifically ask for this. I thought, well, we should really,
sure,
yeah, we should
address
cover it. So we did. Have you ever seen a posterior dislocation?
I have not.
And I haven't either, and that's between 50 years between two of us of seeing patients.
Right.
But it does happen, and it's very interesting. I found it on who it does happen. But let's look at what does happen.
Well, first, the percentage-wise, Brad, it's only 2 to 4% of shoulder dislocation.
Exactly.
So that's why we haven't seen
Right.
it.
It's pretty small.
Pretty rare.
Shall we look at the mechanics
Sure.
of it? Here we got the ball of the humerus, the shoulder joint into the glenoid fossa.
The socket.
And typically, the shoulder comes out this direction, towards the front.
That's the vast majority of them go this way when they dislocate.
Right. Posterior means going to the back side, ends up back here. And one thing they did say, a lot of times these get missed because it's not real obvious. But if it's back far enough, this bone right here, the coracoid process, you can see that protrude much more prominently.
Yeah, I could see that. So you're looking at the shoulder, and you're going to see a big bump here.
Right.
And
exactly.
That's what that is. That's what that is.
Mm-hmm. Okay. And then if you got Gumby on your shoulder, he'll let you know.
Yeah.
Anyways, let's go on with that. If this does happen, well, let's talk about who it happens to. This is really interesting. If you just look at that 2 to 4% and you put them in a subcategory, 15% of these people who have bilateral or both shoulders posterior dislocate, they're almost always as a result of seizures.
Wow, interesting. So they land, they have a seizure, and they fall a certain way?
No, they have a seizure and the muscles tighten up.
Oh, you're kidding.
Right, so much they pull the joint out of...
Oh, so they happen to both shoulders at the same time?
They happen at the same time. Okay.
Interesting.
Yeah, that was interesting. And the majority, the rest of them are from trauma.
Sure.
Okay, falling down, car accident, motorcycle, whatever it may be.
Again, something very unusual, whereas the anterior dislocation can happen just from, putting your arm out in the wrong position.
Right.
No trauma involved at all.
And the age, most of them are between 35 and 55 years old.
See, an anterior dislocation coming forward, that's going to more often be a younger patient, quite often, because they have the looser shoulders and they pop out easier.
Yep, exactly. Typically, if this happens, the arm internally rotates and abducts, so you kind of look like this. And it's painful, particularly to go out, but pretty much any direction I would suspect would not be comfortable. But this is how it looks when that posterior happens typically.
So if I come up to you, Brad, and I'm hurting, my shoulder's like this.
We're going to the ER.
Okay, we're going to check it out.
Yeah, you can go on the internet and try and read how to put it back in, but I would definitely say go to the ER, let someone who knows what they're doing.
And that's with an anterior dislocation too. I know I've seen people do it on their own. I've seen a friend do it on his own, but he's done it many times, unfortunately.
Yeah, that's another story.
Yeah.
As far as treating this, typically it's in a sling, immobilize it for about 4 weeks, depending on how severe it is. There may be surgery needed to, if things are tore, the labrum, the rotator cuff, that kind of thing.
Just like in any dislocation.
Right. Otherwise, I think we could just do some of our rotator cuff strengthening exercises as long as it's not painful.
And we've got a lot. I'll put them at the end here, Brad.
Sure.
We got some videos on how to strengthen after you've had a dislocation, and some of the exercises you want to do. We have one on range of motion after dislocation. And we have that one on
very popular too. These shoulder ones people want to know about shoulder problems because there's a lot of shoulder
very
problems
common
out there.
to have issues like that. So
most people got 2 shoulders, so that's 2 injuries per person.
This is a brilliant guy here. All right. Thanks for watching.